This module will discuss hemodialysis, another type of dialysis for treatment of kidney failure. Hemodialysis is often done in a hospital, but can also be done in a satellite or community unit, or in your own home. In this module, we will explain what hemodialysis is. Hemodialysis is also called hemo or HD. We will explain how hemodialysis works. The benefits of hemodialysis will be reviewed, and what other things you need to consider when thinking about hemodialysis as your dialysis choice. Hemodialysis is one of the options for treating kidney failure. Hemodialysis uses a machine and an artificial kidney to clean your blood. The artificial kidney is also called a dialyzer. To do the hemodialysis, your kidney care team needs to be able to access your bloodstream. There are several ways to do this, which we will talk about shortly. Hemodialysis can be done in your own home, in a hospital unit, or satellite or community center, depending on what is available in your province. To do hemodialysis, your kidney care team needs to have access to your bloodstream to be able to connect you to the artificial kidney or dialyzer. This is done using a fistula or catheter. A fistula is created when a surgeon connects an artery and vein together. This is usually done in your lower arm, but can also be done in your upper arm or even your upper leg. When the artery and vein are joined, blood from the artery flows into the vein. This makes the vein bigger and stronger. It usually takes about 6 to 8 weeks for the fistula to be ready to use. When the fistula is ready to use, 2 needles are put into this vein so you can be connected to the artificial kidney and dialysis machine. A fistula can last for many years and has the least chance of infection or clotting. For most people, a fistula is a better option than a catheter, which we will talk about next. A central venous catheter, or central line, or CVC, is another way to access your bloodstream for dialysis. It is a large catheter that is usually placed in a large vein in the neck, the jugular vein. The catheter is inserted with local anesthetic or freezing. Catheters can also be placed in the chest, groin, or leg. It can be used immediately after placement. With a hemodialysis catheter, you cannot swim in a lake or take a submerged bath. Showers are just fine. There are several location options for hemodialysis. These choices depend on several factors, including your health, where you live, your home situation, and what is available in your province. You can do hemodialysis in your own home. You are trained to manage your own hemodialysis at home. This is called home hemodialysis. We will explain about home hemodialysis a bit later in this video. You can do hemodialysis in a self-care unit. You are trained to manage your own hemodialysis in a community setting. You may or may not have a set schedule. This depends on the self-care unit. You can also do hemodialysis in a satellite or community dialysis unit. These units can be in a community setting, small hospital, shopping mall, etc. A team of nursing staff supports your hemodialysis. Generally, you need to have stable health to dialyze in these settings. Finally, you can dialyze in a hospital or in-center unit. These units are located in larger hospitals and are usually for people who require extra medical support. There are many things to know about hemodialysis. A person will have a set schedule for their hemodialysis unless they are on home hemodialysis. Most people are on hemodialysis 3 times per week: Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. You may be on a morning shift starting at about 7 a.m., afternoon shift starting at about 12:30, or evening shift starting at about 5 or 6 p.m. Each treatment is usually about 4 hours, although this depends on your overall health. Because your bloodstream is already being accessed by hemodialysis, any blood tests you need can be done while on the machine. There is about 1 cup of your blood outside of your body while on hemodialysis. Most people have between 4 to 6 cups of blood in their body. While on hemodialysis, all your blood circulates through the artificial kidney and dialysis machine about 20 or more times. Unless you are on home hemodialysis, you will need to travel to a hemodialysis unit. Home hemodialysis requires a good water source, special plumbing, and electrical systems for the hemodialysis machine. Most dialysis programs pay for the renovations that are needed to do home hemodialysis. The machine and all the supplies are provided free of charge. Some provinces also provide a subsidy for the increased electrical and water cost. Home hemodialysis programs train you, and sometimes a caregiver, to safely do your dialysis at home. This training period is usually 6 to 8 weeks, but people are different when it comes to learning. At home, you can choose your own dialysis schedule to fit with your daily activities. Some people choose to do hemodialysis at night while they sleep. The benefits of in-center or satellite hemodialysis are having healthcare providers, nurses, and technicians do the hemodialysis for you. You get to meet other people on hemodialysis. You have no supplies or equipment at home. Things to consider regarding hemodialysis include very little flexibility in your schedule, as hemodialysis units are very busy. It is more difficult to travel for family events or on vacation with hemodialysis as compared to peritoneal dialysis. You must travel to the hospital or clinic for your treatment. Your diet and fluids are more restricted. Needles will be used. For some people, this is very difficult because of their fear of needles, although this can be overcome. During treatment, some people will have headache, cramping, or nausea. These symptoms may be very minor or make each treatment difficult to manage. The benefits of home hemodialysis is that it allows a person more flexibility and control over their treatments. It is easier to work, care for children, go hunting or fishing, and do the things you like to do. You can do more hemodialysis at home, and therefore clean your blood more often. More dialysis means cleaner blood and better health. There are fewer and sometimes no restrictions to your diet and how much fluids you drink. This depends on how often you do hemodialysis at home. A person is usually on less medication, especially if you are doing dialysis 5 or 6 nights per week. You do not have to travel to a dialysis unit. You are always supported by your home hemodialysis team. Before you decide about home hemodialysis, There are some things to consider. You will need home renovations, such as electrical and plumbing, so the machine and other equipment can be safely operated. Most dialysis programs pay for these renovations as a one-time cost. Please check with your dialysis center about what they provide. Storage space for the dialysis supplies is needed. Needles are required to access the bloodstream, just like in-center or satellite hemodialysis. Training for home hemodialysis takes about 6 to 8 weeks, but people are different when it comes to learning. In this module, we talked about hemodialysis, what it is, how it works, the benefits of hemodialysis, and what other things you need to think about when deciding to do hemodialysis, in-center, satellite, or home hemodialysis options. If there is anything more you would like to know, please write down your questions and ask someone on your kidney care team.